me the messages, and if you can share the image which was closest to the what you have seen in the exam, or if you can share um, basically the change in the choices or option or whatever, then answer can be different based on those scenarios. But this is what I could get the recall. Now I'm going to start the session, and just before beginning the session, can you please confirm, is everything fine at your end? Audio video is fine? Yes. So till now, dear friends, I could get the recall of 16 questions, okay, that I'm going to discuss with you guys. And now, like we can see over here, that is first question is muscle supplied by the ulnar nerve, and the student said that multiple choices were possible over here. So among these, if you look at all these choices, what option will you mark that can be supplied by the ulnar nerve? We have only loft muscle in the palm, which will not be supplied by ulnar nerve, that will be supplied by median nerve. What are these loft muscles? We know that lumbrical 1 and 2, lumbrical 1 and 2, O will be opponents, A will be abductor, F will be flexor. All of them on the pollicis side. These muscles are supplied by median nerve, except these. Whatever muscles are there in the palm, they will be supplied by ulnar nerve. So among these, abductor rigidity minimi, okay, fourth lumbrical and dorsal interossei, they will be all supplied by. Yeah, Adi, very good evening. So this question was there, beta, hai na? Next, what we can see over here is this. Which of the following is the function of the muscle attached on the marked area? Now, as student said that this was lateral aspect of the lateral pterygoid plate was given. And we know the same lateral pterygoid plate. On the lateral side of it, we have lateral pterygoid muscle. On the medial side of it, we have medial pterygoid muscle. And this we have discussed in our, like in the class, we discuss always, okay, we discuss the TM joint, the movements at the TM joint, lateral pterygoid particularly 2-3 times the question has been asked already. Now this time only they change the view. Sometimes they give the cut section. This time they have given the skull as a whole. But if they ask what is the okay, but if they ask that what is the this one your action, what will you mark? Now, dear friends, can you please confirm here multiple choices were possible or not? Because protraction can be done and depression can also be done. Retraction and elevation cannot be done by the lateral pterygoid muscle. So we are looking at lateral pterygoid muscle, and accordingly we can say that we have A and C both are true. But if single best answer, then C is the better answer than A. All right. Okay. So they were specific about the deep branch, not in general about the ulnar nerve. All right. So that is one change. Okay. And in this question, can you please confirm whether it was given as multiple choices or as a single? If they give multiple choices, then we have to consider both. Otherwise, if they give single best, then C is the better answer. Now this question, which nerve is not related to olfaction? Now this question is actually a PYQ repeat question, let me tell you, but that time choices were different. So previously when this question was asked, this is a PYQ. Last time the choices hypoglossal was there. Instead of trigeminal, there was 7th, 9th and 10th nerve was there. These are the options that were there. So basically what we observe, and as per many authors, the taste and olfaction, okay, they go parallel in parallel. So the one who is carrying the taste is also involved in the olfaction. May not be directly or dominantly, but that's they are involved there, okay. And so far as trigeminal nerve is concerned, trigeminal nerve has also got some control mechanism, okay, in the olfactory this olfaction pathway. Of course, olfactory nerve will be involved here, and we can consider fifth nerve as a controller. The last time when the question was asked, the options were 7, 9 and 10. But answer was taken as hypoglossal. Even now we are going to take the answer as hypoglossal because that's a pure motor nerve. Even though it has something to do with the tongue, but that is only motor aspect, the muscle supply, not the taste or olfaction, right? Okay, beta. So it was a single best answer, so we will go with that. and here is straightforward. So directly involvement will be of the first nerve. 9, 10, 7, they are involved as a part of taste because many of us believe that they go parallel. But fifth nerve has got involvement in the control over this mechanism. But 12th nerve, no control, nothing. Okay. Next question. Piriformis, this piriform fossa, piriform fossa, this nerve supply. What is your answer? What have you marked? And if you guys can remember, let me show you what is this. This is a page from our workbook. So in our class, after the discussion of a topic, when I take the clinical aspect from that topic, right? So if you remember, after the discussion of 10th nerve and 11th nerve, when we come to the clinical part, Hannah, that time we take this question. Can you remember? Do you remember this page from the workbook? So I have taken the screenshot. And if you see in our workbook, when we discuss the clinical aspect here, we went one more step ahead. This question was halfway. We were discussing further what will happen after this. Do you remember, beta? So if you can recall, I have discussed this question in all the classes, right? After the 10th nerve, that what will happen when internal laryngeal nerve will be gone. So we also come to know that what will happen after internal laryngeal nerve is gone. But the question was only up to the laryngeal nerve, which nerve will be injured. So answer is straightforward. Internal laryngeal nerve will be the answer. Making sense? Now if you can tell me now, let's again revise. Tell me which reflex will be impaired. Is it gag or cuff? Is it gag or cuff? Of course, very good to see that you can recall. It is the cuff reflex, not the gag reflex. Okay, because what really happens for those who don't know this concept, this is the internal laryngeal nerve piercing the membrane. It is present along the floor and coming up to the mucosa. Why? That's the level of the vocal cord. That's the level of the vocal cord. Above, we have all the mucosa supplied by internal laryngeal nerve. Below, we have all the mucosa supplied by recurrent laryngeal nerve. Now, by chance some foreign body comes over here, it touches here. What will happen? The mucosa will be affected. The nerve will be activated. Which nerve? Internal laryngeal nerve. And what will happen? As a response, positive pressure airway will come, which will throw the foreign body out. If they throw the foreign body out, then what will happen? In that case, there will be cuff reflex present, which is called as protective cuff reflex. But by chance, internal laryngeal nerve is gone. In that case, cuff reflex will be impaired. So far, so good. Yes, good to see, beta. You recall everything, है ना? Now let us proceed this. Now, yesterday there was a little bit of debate, but then I asked from many students, and they could confirm that it was the dorsal aspect of the sacrum. Okay, because earlier there was a conflict whether the piriformis were marked or the gluteus maximus was marked. So most of the students, so till now, even though because it's a recall based question, and this is open for everyone to comment now. You can also give your opinion. What I could get the opinion of most of the students, they were saying dorsum of the sacrum was given, and it was the real bone, which I am also showing. No image, it's a picture from the real bone, and marking was there on this aspect, which corresponds to gluteus maximus attachment. If the gluteus maximus was attached, so answer will be hip extension. That's the best answer because gluteus maximus is the chief extensor, but as per its fiber, it can do abduction, it can do external rotation also. But if some students are saying that no, it was the piriformis which was attached from the anterior aspect, maybe the E-shaped muscle. This, if E-shape it is there, then it will be piriformis muscle. Okay, and if the piriformis is there, then it will be the lateral rotator. Its major action is lateral rotation, but it can also do abduction during the flexion. Okay, major action will be lateral rotation. These are all short rotators, but it can also do abduction. So I'm writing in bracket abduction even for the piriformis. So now if it is, yes, you guys also confirming it was a dorsum given, right? Dorsal aspect was given. ठीक है, तो dorsal ही था. सबने ज्यादातर ने यही confirm करा है कि dorsal aspect था और gluteus maximus भी थी. तो gluteus maximus होने से तो answer extensor best होना चाहिए. But because it can also do abduction and lateral rotation as per the fibers. So we will mark the hip abduction as the correct answer over here among these given choices. यही choices थे. अब अगर हम piriformis को भी consider करते हैं, even if we consider the piriformis here, it cannot do internal rotation. It is a lateral rotator or external rotator. It does not have the working on the extension and the flexion of the knee. So basically, even for the piriformis, if we have to mark hip abduction, because during the flexion, it can do the hip abduction. So that will be the answer. The choices were same, beta. Choices यही थे. ये जो choice है यहाँ पे वो same थे. यही choices थे. Okay, very good, very good. So basically, I have put these two pictures just for the reference sake, that it can be either of this picture or this picture. But as per the majority of the student, I have taken this as the final, and the gluteus maximus was marked as students are telling, and hip abduction should be the correct answer among these given choices. Now next, this dura mater of posterior cranial fossa was marked. Now when we discuss the dura mater nerve supply, okay, we always discuss the dura mater nerve supply as per the cranial fossa. So we write what? Anterior cranial fossa, the nerve supply is by anterior ethmoidal plus posterior ethmoidal nerve. I hope you remember this. Okay, and then that means it is the territory of V1 fibers. In the middle cranial fossa, it is the V2 and V3 fibers. And posterior cranial fossa, it is nothing but the 10th nerve, 12th nerve, and C1, C2, C3. And we always write here major. Why? Because C1, C2, C3 are considered as a supplier. 10th and 12th nerve are considered more of the carrier. They will be carrying. Supplier is C1, C2, C3. So we have to choose one answer now. C1, C2, C3 is the major supplier in the dorsal dura part in the posterior cranial fossa, and that is also supplying in the back of the neck region. That's why we will take back of the neck where we will get the pain referred. Okay. Now, the next part, which is not a boundary of hepatocystic triangles, since last 2-3 years there have been many changes, but now the recent version says for the hepatocystic triangle, the boundaries are common hepatic duct, cystic duct, and the right lobe of liver, but not the cystic artery. It is considered again the content. Okay, in between there was a time when it was considered as a content for the Calot's triangle, but now again it has been revised. Okay, so this is the Calot's triangle. We have common hepatic duct, we have the cystic duct, and the right lobe of liver. This is a Calot's triangle where we have the cystic lymph node of the lung, that is the content, as well as we have the cystic artery, that is the content. So far so good. So till now I didn't put the number, but overall total number of questions are 16. So very significant number. Okay. Muscle supplied by superficial peroneal nerve. Very, very, very easy. This was the question, beta. Superficial peroneal nerve. क्या आंसर लगाया आपने? Obviously, it is the lateral compartment muscle and lateral compartment nerve. So lateral compartment muscles we are talking about. In the lateral compartment, we have peroneus muscle. What option have you put? आपने क्या mark करा है? It is peroneus longus and peroneus brevis, right? These two are the muscles of lateral compartment will be supplied by superficial peroneal nerve. Peroneus tertius and extensor hallucis longus. These are the muscles of extensor group or anterior group will be supplied by deep peroneal nerve. Deep peroneal nerve. Peroneus tertius, beta, it will be taking supply from the deep peroneal nerve. AB should be the correct answer. Which nerve does not help in olfaction? We have discussed that's the 12th nerve. That's the major nerve there. Next question is this. This is integrated question. It's not from pure anatomy. It is like ortho and anatomy both integrated is there. So basically a teenager is there coming to the emergency and there's a history of fall. And after the history of fall, when you examine, there is a tenderness in the anatomical snuff box, right? This was the question, beta. This type of question was there, that history of fall, tenderness in the snuff box, we are worried about a bone, and this is also from our regular classroom notes. And I told you this is very frequently asked area, and answer is straightforward, scaphoid. What have you marked? Scaphoid only, है ना बेटा? ऐसा क्वेश्चन था ना? ये क्वेश्चन सही है? Now this, can you tell when you see this question, when you saw this question in the exam. Did you remember me? Because after we are done with fourth and the sixth now particularly, we take one clinical session. And in that clinical session, I always describe the gaze in detail. And I always take MLF syndrome, one and a half syndrome, internuclear ophthalmoplegia. Did you guys remember this? Okay, so they went further beyond also. Okay, fine. Now ये वाला जो particular question है, ये question था ऐसा और ये आप लोगों ने पक्का solve करा होगा. Internuclear ophthalmoplegia. Did you remember me at that point? Okay बेटा, समझ आ गया कि वो वाला पार्ट में आपको मैनेजमेंट पे लेकर के गए थे, तो इट इज मोर फॉर द ऑर्थो एस्पेक्ट, है ना. बट एज ए सेड टॉपिक इज वेरी वेरी इंपॉर्टेंट. ना ऑल्सो प्लस गिव द फीडबैक फॉर दिस पर्टिकुलर क्वेश्चन. ये क्वेश्चन था और इसमें आपने इंटरन्यूक्लियर ऑप्थेल्मोप्लेजिया पे मार्क करा है. ओके, ए इज द आंसर क्योंकि this is the baseline. The eye can move on this side, I can move on this side, but here there is something is missing although. Okay, because at this stage we can't simply say. There should be some more, one more picture should be given where convergence should be shown as present. Okay, convergence present, then we can say it is a pulse, because here right now it is difficult to comment. Okay, है ना. So convergence, if it is present, we will take internuclear ophthalmoplegia. All right. And the baseline, there is no deviation. Otherwise, third nerve palsy will not be looking directly here. In the third nerve palsy, the baseline also be affected. What will be the effect in the baseline? There will be down and out eye will be seen, right? Next question. This is just to show you, this is what we discuss in our class. This is again a screenshot from our workbook. And when we go beyond it, we always discuss PPRF and ipsilateral MLF gone. Now, can you tell me quickly what will happen if these two are gone together? If these two are gone together, it is called as one and a half syndrome. It is called as one and a half syndrome. Okay. Now, cleft lip primary muscle repair. This is a straightforward question. So they did not ask the different type of cleft lip. Sometimes they ask that which processes could not meet. Okay, this is a PYQ. Previously, it has been asked. This development of lip palate region is important from our exams point of view. They keep on asking. But earlier they used to ask if the midline cleft is there, which processes could not fuse, if unilateral defect is there. Hai na? This time they asked primary muscle. So whatever is there, orbicularis oris, we have to do the muscle repair. A is the answer. Now this particular question, the students were saying that bladder picture was there, some ABCD was written, and I could get this picture. Was it similar to this or was it not like that? Some other view was there. Can you confirm? I could get this. So I just prepared the question for the recall's sake that this is the bladder. Just let me tell you, this is the urinary bladder. And can you check the correct answer over here? What is A is the prostate. Okay. What is A is prostate. What is B is ureter. What is C is vas deferens. And what is D is seminal vesicle. Okay, this image is not same. Dissected specimen, it is also dissected specimen. First of all, my idea is, can you please confirm, was it the same section, the view was same? View same था, ऐसे section से लिया हुआ था हमने या हम behind से देख रहे थे? Because these structures can be seen either from the lateral view or we can also see from the posterior view. So this is also cadaveric picture. What you are saying कि dissected specimen था, cadaveric था, अलग था, only bladder था. It was only bladder, it was removed. कैन यू ऑल प्लीज कंफर्म ये जो सेक्शन आपको मिला है वो सारा का सारा अलग, मतलब वी हैड ऑलरेडी रिमूव द सेम व्यू था, ये तो पक्का है लैटरल व्यू था। ओके, वेरी गुड। सो वन थिंग इज कंफर्म, लैटरल व्यू। सेकंड थिंग इज दिस वाज कैडेवरिक इमेज। सो ये दो बातें तो मैच हो रही हैं। सेपरेट था, ये बात जो यहां पे आर्टिकुलेशन में दिखाया गया वो नहीं था, इट वाज ए सेपरेट इमेज। ओके, ओके, but otherwise more or less structures. Now can you correlate? And in from that part it was only bladder that was removed specimen. That's the difference between this image and the image which was given in your exam, right? It was a separate specimen, cadaveric and lateral view. Anterior view था। एंटीरियर व्यू से कैसे, मतलब थोड़ा, आर यू श्योर कि एंटीरियर व्यू था? सभी लोग कंफर्म कर सकते हैं? कैन यू प्लीज कंफर्म कि व्यू कैसा था? ओके, 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 पोस्टीरियर व्यू ही था। ऐसा लग रहा था कि अलग अलग रखा हुआ है। ओके, कुछ अलग प्रकार से पोस्टीरियर वॉल को ही काट के अलग दिया हुआ था, तो व्यू तो पीछे, तभी मैं कह रहा हूँ कि ये सारे स्ट्रक्चर तो बिहाइंड ही होते हैं ना, एंटीरियर से उतने अच्छे से अप्रिशिएट तो हो ही नहीं पाएंगे। ओनली ब्लैडर पोस्टीरियर व्यू एज इफ द पोस्टीरियर वॉल वाज कट एंड द बोथ यूरेटर वर विजिबल एंड द स्ट्रक्चर्स वर विजिबल। सो बेसिकली आइडेंटिफाई कैसे करना है हमें, मैं जस्ट एक आपके शेयर कर रहा हूँ। इफ आई कुड गेट दैट इमेज, आई ट्राई टू फाइंड आउट दैट इमेज नाउ, ओके। एंड मैं उसके बाद किसी ना किसी मीडियम पे, टेलीग्राम पे, इंस्टाग्राम पे, कहीं ना कहीं मैं हर एक जगह पे उसको मैं अपलोड कर दूंगा, ठीक है, ताकि वो आप तक भी पहुंच जाए। ओके, यूरिनरी ब्लैडर वाज केप्ट फ्लैट, पोस्टीरियर वॉल को कट करके दिखाया हुआ था, इट वाज रिफ्लेक्टेड। वेरी गुड, आई गॉट द आइडिया नाउ। और बोथ यूरेटर्स वर विजिबल। ओके बेटा, थैंक यू सो मच एवरीवन, है ना। शिवाशीष, अंकित, दर्पण, भव्या, ऋत्विक, प्रतिभा, अमित, everyone, thank you so much for your feedback and this, you see, helping me. मोहम्मद आशिक, सोनी, डॉक्टर शाल्या, निंगप्पा जी, है ना। बिकॉज ये क्या है कि अभी now I am taking this feedback, so I'll change the image. But right now, let me explain. When we look at the bladder के below neck region पे we have the prostate. So that's why I could get the idea that's the prostate. This structure is coming from above and entering at the angle of the bladder. So this has to be ureter. Now there will be two structures. One will be present only behind. Okay, that will be seminal vesicle. One will be having anterior things also present because the vas deferens will be coming, which shows some dilatation. The dilatation part is called as ampulla. Okay, that's the vas deferens. Yes, 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 Sneha, that is also true. वो below होगा, that is correct. Now this picture, I don't know whether this was there. The student said dissected specimen of the heart where these structures were visible. Now whether it was cut section or this was there, it was similar to this image, the heart image. इसमें मैच द फॉलोइंग था कि who will be receiving the oxygenated blood from the pulmonary vein, who will be lying anterior to the aorta, arises from the left ventricle, hypertrophy in pulmonary stenosis. So this is what is the answer. The one who receives the oxygenated blood from the pulmonary vein is left atrium. Left atrium is D. This is the left atrium. Okay. The one who lies anterior to the aorta, this is the aorta. This will be pulmonary trunk, है ना? So that will be pulmonary trunk. It was transverse section and view was from above. Okay. If the view was above, then there can be one more thing. Okay. Acha, vertebrae was also visible. Cut section of the heart was there. Vertebrae was also visible. And that section you had to find out whether it was what, right? Ventricle and everything was there. Okay, this is the cut section. Superior view. This this type of picture was there. This question was there or not there? Students were saying that the marker was on the respiratory bronchiole. Okay, the respiratory bronchiole. That's why I'm putting this at the respiratory bronchiole. I have added this labeled picture for you guys because the terminal bronchiole, the thickness will be a little bit more. Respiratory bronchioles are those which will lead to the portion which is required for the pure exchange. Up to the respiratory bronchiole, this portion is called as conduction zone. Beyond that, it is called as a respiratory zone where the real respiration will take place, the real exchange will take place. Okay. Okay, so cut section of the thorax tha. All right. Okay, so yesterday when I was discussing in a group, that time I asked that which was thorax shown, then they said no, only heart was shown. So I removed that. I had that picture also with me, that cut section of the thorax one. And there we can very easily visualize. I think that's like kind of picture was repeat. That means during the PYQ discussion session I have discussed that picture with you guys. Chalo, again I will frame this. Okay, I'll frame this question. Okay, cut section of thorax was, it's not only heart. So I was under the impression कि only heart का picture है. That's why I changed this. Okay. Otherwise, I'll reframe this. No problem. Otherwise, choices are same and we know the answers, but we have to identify. Identification is must, and that is sometimes very tedious job when we get such type of images. है ना? तो कोई बात नहीं बेटा, मैं उसको भी प्रिपेयर करके आपके लिए अपलोड कर दूंगा. ठीक है? इसमें थोड़ा सा समय और लगेगा. Now this picture was there and the respiratory bronchiole, I have provided this picture also. And this was there, some islet of Langerhans were there and they asked कि neighboring cells को कैसे influence करता है. The language itself is saying the neighboring cell will be influenced only by the paracrine mechanism. So paracrine mechanism will be taken, right? Okay. So that was all, dear friends. So it was kind of a mix, I will say, because of the images. You must be knowing the answer. You know ki, like who will get hypertrophy in the pulmonary stenosis and other type of stenosis. But the question is how to identify. So that is the catch here. But I believe that फिर भी आप लोगों ने, like what anatomy we have discussed, some of the questions were direct from the class notes. Some images I have discussed, like I have put from the workbook itself. So at least those portions. Even that the internuclear ophthalmoplegia is not piece of cake for everyone. Those who have attended the lectures, those whose concepts are clear, they will be able to mark the correct answer. Okay, and also yes, of course, for the identification part that needs practice. So we will focus more on that, and in the coming days we will add more and more sessions on that particular part also, है ना? तो उसकी भी revision हमें बहुत बार करती रहनी पड़ेगी. Yes, I will provide this PDF also to you guys. So thank you so much, dear friends. आप में से ही बहुत लोग अब फ्यूचर एम्सोनियंस, फ्यूचर पीजीआई एंड जिपमर के रेजिडेंट्स बनने वाले हो, है ना? टू ऑल दोज future residents of AIMS, PGI, and JIPMAN, and all the central institutes, I am congratulating you. I think I am the first one to congratulate you because even the results have not declared. So once you pass and you join, you thank me later. Okay. All right. All the very best. God bless you all.